This is Terrence Andre Banks with Information Age Financial Solutions, coming to you from an article I read from MarketWatch about the upcoming proposals for Social Security and healthcare. Definitely one you want to pay attention to. As always, I'll put a link inside the description. Trump's budget proposal probably won't reduce your Social Security checks, experts say, but it will lower your quality of life in healthcare. This proposed plan cut programs that senior jobs and nutrition, and with one of the largest populations, because now the millennials is taking over the baby boom population in terms of demographics. It's still very important to find out what affects them will eventually affect a great portion, especially in the American economy, but also just videos I've done before about, we have 2 billion. I think there was a video I did before where Kiyosaki pointed out there was 2 billion people looking for retirement and coming in this particular decade, and how that's going to have such a global impact on financials, and really not prepared for it. So again, I kind of digress, but I'm going to put a link inside the description. I'm going to dive right into this article. President Trump's 2021 budget proposal takes swipes at entitlement programs like Medicare and Social Security, and targeting those and other programs could adversely affect older Americans and their quality of life, experts say. The budget, if it were to pass, which is seen as very unlikely, would trim about $505 billion from Medicare over a decade, and $35 billion from Social Security disability insurance and supplemental security income, adding to the bipartisan committee for responsible federal budget. And they're saying it's very unlikely, but with things going the way it is, and unlikely is probably not the best word to utilize here. But again, keep reading on. The proposal calls for tightening eligibility requirements for the Supplemental Nutrition Assistance Program, also known as food stamps, and toughening Medicaid eligibility requirements, such as enforcing asset limits. The good news for Medicare and Social Security retirement beneficiaries: these cuts don't directly affect participants' benefits. The bad news: provisions within the proposal could undermine retirement security all the same. The plan supports combating the opioid epidemic, increasing vocational training for high school students, assisting incarcerated persons with reentering communities, and increasing security at the U.S. borders, among other recommendations. The plan will make a big dent in the federal budget deficit, said Russell Vought, the White House Office of Management and Budget Acting Director. Some of the reductions to Medicare would actually help beneficiaries, said Mark Owen. Can't believe this. Senior Vice President and Senior Policy Director of the Committee for a Responsible Federal Budget. The Medicare spending reductions, along with reforms to prescription drug, would amount of roughly $600 billion in savings, which could lead to lower premiums and out-of-pocket costs. The downside for Medicare participants: some of the changes could affect healthcare choice for patients. The proposal suggests a reduction in payments to healthcare providers, such as doctors and hospitals, and if the payments are cut too much, some providers may not participate in the Medicaid program, said Dan Adcock, Director of Government Relations and Policy at the National Committee to Preserve Social Security and Medicare. If that were to happen, seniors would have limited options for selecting their own doctors, he said. The plan would also extend the time beneficiaries need to spend in intensive care units before they are authorized to have long-term care at skilled nursing facilities thereafter, said Monique Morrissey, an economist at the Economic Policy Institute. Right now, the requirements in 3 consecutive days, not including the day of discharge, but the proposal changes that to 8 days. The budget doesn't focus too much on Social Security old age benefits, which pay out retirement benefits, but it does make changes to Social Security disability, which affects Americans of all ages, and supplemental security income for seniors with limited income or resources. The proposal includes promoting work for SSDI and SSI beneficiaries, which is unlikely to happen, Goldman said. Beneficiaries who claim disability insurance are usually severely disabled, and attempting to move them off the system via draconian, Adcock said. It stacks the deck against them by trying to push them out of the program. Older Americans are disproportionately affected by cuts to disability programs, Morrissey said, especially who haven't turned 65 yet and therefore cannot receive Medicare coverage. The problem is those who will never work again, she said. Additionally, retroactive benefits will be reduced from 12 months to 6 months for disability beneficiaries, Goldman said. Other savings come from funding or SSDI and SSI program activities, such as attempting to limit fraud or double payments. Some of these changes, such as ones to Medicare, would help sustain the programs, Goldman said, and ideas found in the proposal have been echoed in Democrats' proposals too. The reality is the cost of Medicare is high and growing fast, he said. We have to make changes soon, and these are good ideas with bipartisan support. There are recommendations that highest assistance to seniors in other ways, such as creating approximately 1,200 housing units for low-income, elderly, and persons with disabilities. Medicaid is also in the spotlight. The proposal introduces asset limits and restricts eligibility for able-bodied adults, according to the Committee for Responsible Federal Budget. The budget proposes slashing certain proposals that benefit older Americans' quality of life, including those that give them jobs and nutritious meals, as Cox said. The proposal eliminates federal block grants that support Meals on Wheels. The program delivers healthy meals to seniors who may otherwise be socially isolated, as well as eliminates the low-income home energy assistance program, which helps low-income families pay for energy bills and keep their homes warm during cold months. The budget, if passed, as it would eliminate the Senior Community Service Employment Program, which assists low-income and unemployed Americans 55 years and older with finding part-time training for jobs at nonprofit organizations. The program is a lifesaver to a lot of seniors, Adcock said, adding that many older Americans are at risk of running out of retirement savings and could use a salary to prolong their finances. Unlike the proposal, SNAP participants will be required to have 20 hours of work, training, or community engagement in order to receive benefits. We don't think of those as programs for the elderly, but they are important ones for retirement Social Security and those who can't work, said Sean Fermerstead, Senior Policy Fellow at the Center for Economic Policy Research. This isn't the first time the Trump administration has suggested cutting funds to entitlement programs. The White House made similar suggestions for fiscal years 2020 and 2019. But this is an election year, and Congress members up for re-election may be hesitant to vote for cuts to those programs, Fermerstead said. The proposed cuts also come less than a week after the president said he would protect Medicare and Social Security during his February 4th State of the Union speech. Again, just to be aware of this, what they're standing here probably won't come, but these changes are sweeping, and they're pretty, they're pretty aggressive. So this article is definitely worth paying your attention. We'll put a link inside the description, as mentioned. As always, think things differently. If this video has been any value to you, please subscribe, leave some comments. Until my next video, I'm out.